Excellent, great. Thank you to everyone who is tuning in and joining myself and Libby in the webinar that we are doing focused on foot awareness and golf. This is a webinar that is hosted by both Naboso Technology and Boditrak Metrics. So thank you to both of those. I will be referencing some of those products throughout, and hopefully you enjoy the webinar. Now, just before I jump into the content, just some brief housekeeping is that this is being recorded. So if for some reason you get disconnected, you want to listen again, you want to share it, it is being recorded, and everyone who has signed up will get an email with that recording link. It will also be sitting on YouTube so that you could share it with some of your colleagues if that is something you are interested in. And we will be sending the PowerPoint or the PDF to that as well. So if you would like that, just look for that email. If you have any questions as we go through the content, then please do type those questions in the chat box or the Q&A. I'll be checking both places, so you could type it in either, and we'll make sure that we get to those. We will save some time at the end to make sure that we go through some of those questions. Now, as we jump into this foot awareness and golf, one of the sponsors is Naboso, which I will be referencing throughout, and then of course at the end. And this is a sensory product line that is helping people build foot awareness. And then our other sponsor is Boditrak Metrics and Boditrak Golf, that I'm sure many of you are familiar with Boditrak Golf. I'll be referencing why and how I like that product and integrate that product with my patients, whether it is for assessing golf and the golf swing or just in general for some of their weight distribution and pressure shifts. Real quick, if you're not familiar with my background, I am a podiatrist, a functional podiatrist. I am the founder of Naboso and all of our products. I am an educator through EBFA Global, where I travel around the world speaking about barefoot science, about our foot, primarily from a sensory perspective. I love foot biomechanics, but really my passion is within the sensory side of the foot and how powerful that is in optimizing movement and performance. And I do consulting for many companies. You can learn more and follow me on Instagram, which the handles are above. And then I will include some additional information towards the end. Now, the big thing that I want to focus on in this webinar series is I will not be speaking to you about how to perfect your golf swing. That is not my forte. My forte is the sensory side of the foot and how we can optimize what we're getting out of our feet. However, I do want to set the tone for this webinar by understanding and emphasizing that there is a big difference between a weight shift and a pressure shift. So if someone is actually shifting their center of mass, this was a great article that was in association with Boditrak Golf. You can see the mat below the golfer's feet is saying that when someone is shifting their mass during a golf swing, you obviously can see that. When someone is shifting their pressure under their feet, you can't see that. And that's where tools like Boditrak Golf is really powerful, because it gives you that data and it gives the golfer some of that feedback to understand where and how and what's the timing of that weight shift. And then I will, or that pressure shift, and then I will integrate how we can use Naboso for that. Now, in order to be doing a accurate and a smooth pressure shift in the feet without actually moving your center of mass, the golfer has to be able to feel their feet in the first place. So understanding that awareness, how connected is the golfer to their feet during that swing execution? If it is hard for them to connect to the subtlety of that shift, then that may then be compensated by them saying, I need to use my actual mass and shift my center of mass, which again is going to change the strategy of force production behind that golf swing. So having an awareness. Now, that awareness of the golf swing is based off of two main things that I want to focus in this webinar. Is in order to have this optimal pressure shift, weight transfer shift, which is underneath the feet from the back to the front, from the side to the lateral side to the medial side. You have to be able to have that potential within your feet. So do you have sufficient range of motion in the joints of the foot to allow for this subtle weight shift? If you don't, then the golfer will have no choice but to actually move their center of mass. So this is where we want to understand, and we need to understand, well, how are these joints moving in the foot in the first place? And where does it sometimes go wrong? And why do we sometimes need to use other strategies, mobilization techniques, maybe some orthotics for some of our golfers to then optimize that function? So there are going to be 3 joints that I want to focus on in the foot that need to have optimal subtle ranges of motion to allow for this pressure transfer. That is going to be our ankle, our subtalar joint, and our talo-navicular joint. If you are familiar with this joints, then just think of this as a subtle review for you. If you are new to breaking down the foot, then we just kind of take this in. If you need to listen again to understand and appreciate the way that these joints move, then I by all means encourage you to do that. So we are looking at really the rear foot and the midfoot and how they interconnect and relate to each other. So if we just take a moment and look at the X-ray, I want you to appreciate that we have 2 leg bones, 2 foot bones, and then we're going to shift forward to this beautiful bone called the navicular. These 3 areas is where that articulation is happening. Now, formed by your tibia, fibula, and talus, that's going to be your ankle joint. We need to have a certain degree of ankle range of motion to then allow the joint below it to move, which is going to be formed by your talus and calcaneus, which is your subtalar joint. And then your 3rd joint is going to be your talo-navicular joint. So ankle joint, subtalar joint, talo-navicular joint are all articulating with each other, and then their articulation, super important, is translating upward into the hips, which is the other area of the lower extremity, which is extremely important for that golf swing and the proper timing of that golf swing. So when we think about our ankle joint, a lot of people will think about this joint as purely a sagittal joint, that you are going through dorsiflexion and plantar flexion, which is sagittal. That is true, but those are not the only joint movements of, or the only planes of motion in our ankle joint. So if you don't mind joining me for 1 second, and if you take your right hand and grab your right ankle bones, your malleoli, your ankle bones. And what I want you to do is appreciate, shut your eyes if you need to, and I want you to feel how your right thumb is on your medial malleolus, which is your tibia, and then your index finger is going to be on the lateral side, your fibula. Eyes are shut so you can feel that the tibia, your medial malleolus, is sitting in front of your fibula or your lateral malleolus. And then stay there again for a moment. Your tibia or your medial malleolus is sitting higher than your lateral malleolus. So if your hand is on the ankle bones, you can feel that there is this diagonal or oblique orientation to the ankle joint axis. That is telling you that the ankle doesn't just do dorsiflexion, plantar flexion. This oblique nature deviated it into what is referred to as the transverse plane. So technically, every time you dorsiflex your ankle, it actually wants to go out, which is abduction. And then when you plantar flex your ankle, you go into a adduction. So those are they're called joint couples. So dorsiflexion, abduction is a couple, and then plantar flexion, adduction is another couple. This will be important because the joint coupling that we want to think about also is the compensation that your golfers are going to go into if they do not have sufficient sagittal range of motion. So I'm very important how I'm tying this back to the golf swing and where we might see some of the compensations. Okay, so ankle joint does dorsiflexion, abduction, plantar flexion, adduction. We need to be able to get the dorsiflexion as you're going through that swing, because it's what's allowing the ankle to unlock to then essentially load the energy that you're then going to release into that golf swing. Okay, so that's going to be our ankle joint. Let's just put that on the side for a moment now. Now, just below your ankle joint is going to be your subtalar joint. This is formed by your talus and your calcaneus. This is probably a joint that all of the golf coaches are quite familiar with because of how the foot moves during the golf swing, is that you need to have some sort of rolling to the outside and the inside, which is inversion and eversion. Now, these movements, you can see the image here. So inversion is when you're on the outside of the foot or you're moving through that position. And then eversion is going to be on the inside of the foot. Now, there are oftentimes adjectives that I will give to these movements and that I want you to think about, is that every time your foot is moving into an inverted position or you're rolling to the outside of the foot, that is going to be associated with a locked, rigid foot. Okay, so if you are starting in a locked, rigid position and your golfer's having a hard time moving through the subtalar joint because they have too much inversion, that's going to lock all the way up into those hips. So something to think about. Okay, and then when we go into the everted position, which is here, that's going to unlock the foot. It's going to momentarily destabilize the foot, but it's actually necessary for loading energy and power into the foot. So we need to evert to invert is what I like to say. Okay, and kind of that dancing back and forth between unlocking and locking is really the secret sauce of the foot and the subtalar joint during athletic performance, of course, including the golf swing as well. Okay, so we have our subtalar joint relating to the ankle joint. Now, if we put them together in association, is you can actually couple the ankle joint with the subtalar joint. And the couple that you want to think about is going to be this. So a plantar flexed ankle is an ankle that is more rigid. So a plantar flexed ankle is in association with or coupled with this inverted position. And then on the other side, a dorsiflexed ankle is technically considered unlocked, and it is in association with or coupled with an everted foot position. So when you go down into the bottom of a squat or you load energy and you dorsiflex your ankle and you shift your tibia forward, you are having a degree of eversion in the subtalar joints because they have that coupling nature. Now, too much of anything is not going to be good because it starts to create these compensation patterns. But for the most part, I want you to think about dorsiflexion, abduction, eversion all go together, and then plantar flexion, adduction, inversion all go together. And those are the couples, okay? So now this is where it's going to get into how you're assessing your athletes. So when your athlete is going through their swing, and if there's a moment in time that they are dorsiflexing, which they have a little bit of a knee flexion throughout the start of that golf swing and as they're going into the backswing. So we know that there is ankle dorsiflexion as part of a golf swing position from a foot and ankle perspective. Okay. Now, if the golfer has insufficient ankle dorsiflexion, what they're going to do, and we can see it in these pictures here. I know it's a squat, but the exact same thing is going to happen when they are in their swing position. Let me go back a step. When we go through our ankle, we want primarily sagittal plane range of motion, which means we primarily want dorsiflexion. Yes, there's a little bit of transverse, that abduction that I was speaking about, but we primarily want sagittal. We want to move through the sagittal plane of our ankle. If you do not have sufficient ankle joint sagittal dorsiflexion, the athlete's going to compensate. And how they compensate is they go around the ankle, unlock, and go into an abduction position. So they don't have sagittal, they take transverse. What happens when we go into that abducted position that's going around the ankle joint, Do you see how I just dropped into the middle of my foot? So I just dropped, which is going to be our next joint we go into, which is the talo-navicular joint, but I drove that range of motion into the subtalar joint as well. So this is a very unstable position because of what it's doing up the rest of the chain into the hips. Okay, so if you're seeing that your athlete, as they try to go through their ankle, they drop and they essentially spill into the middle of the foot, they have insufficient ankle dorsiflexion, insufficient ankle sagittal plane. Boom, they just compensated, unlocked, destabilized, which means now when they go through the opposite part of that swing, they're not going to be stable, or it's going to translate into an unstable pelvis and hip. So let's get into the next joint, and then let's try to connect that a little bit higher up. Okay, so this is where we go into the joint forward, which is your talo-navicular joint. Now, in your talo-navicular joint, this is where you're going to see the relationship of your subtalar joint with your midfoot. And you are able to palpate your own navicular if you would like. You could kind of X marks the spot on your athletes, and I would highly suggest doing this and then having them do their golf swing on the Boditrak mat. So you are not just looking at the pressure distribution and the timing of the pressure transfer, but you're also looking mechanically what is happening. Are they dropping into that talo-navicular joint as a compensation for limited ankle dorsiflexion? And then that is showing what you're seeing from a pressure distribution. So we always want to be making sure we match what we see with the naked eye, mechanically bones and joints moving, with what we see on a pressure mapping. And then ultimately we're going to go into how does that athlete control it when you're not looking at that pressure map, and what is their essentially sensory connection to their weight transfer. Okay, so if you look at your foot and you put your thumb on your medial malleolus. So I am on my own ankle here, and I'm putting my thumb on my medial malleolus, and then I'm going to go down a thumb, and I feel this indent. That is going to be my talus. And then I go down another thumb, and I feel this really prominent bone. That's going to be my navicular. X marks the spot, put a dot on it like the picture here. And what your talo-navicular joint does is it's actually referred to as your second ankle joint. So when I teach workshops through EBFA, this is a big part of how I differentiate different foot types, different flat feet, especially in athletes, is to understand that there's a difference between midfoot pronation and rear foot pronation. So your talo-navicular joint, which is your second ankle joint, is deeply integrated with your subtalar joint and your ankle joint. If you don't have enough ankle dorsiflexion, you're going to compensate into that subtalar joint. And because it has a relationship with the talo-navicular joint, it's going to destabilize that joint. Okay. Now, the movements of your talo-navicular joint, because it's your second ankle, is going to be the exact same thing as your ankle. It plantar flexes and adducts, it dorsiflexes and abducts. So I totally want to do this with you guys so that you can feel this and move with me, because the more that we are interactive with our feet, it's going to make a big difference in how you actually are working with these athletes. So I'm going to move my camera so you can see. Okay, so here's going to be my navicular right here. And if you want, I'm grabbing a pen. If you want to do this with me, unfortunately that pen doesn't work. So my pen is not working, but it's okay. Take your pen and mark your spot right there. X marks the spot. I want you to mark your navicular. Okay. And here's your navicular. I want you to, if you can see me, I'm going down like this, and then I'm going up like this. All I'm doing is everting my feet, inverting my feet, everting, inverting. Now keep watching that spot on your navicular. Every time I evert, do you see that my navicular dropped down? Okay. And then every time I invert my foot, my navicular lifted. So inversion of the foot is going to lock your midfoot. Eversion of your subtalar joint is going to unlock your midfoot. Okay, unlocked is going to equal unstable. Okay, momentarily unstable. Inversion is going to be locked, rigid. So if your athlete has a navicular that is lifted and stuck, their midfoot is locked. What is this going to do higher up? That is the whole name of the game. That's what we're talking about. We're here not just to talk about feet, but to also talk about what is happening further up into the hips. So this is where it's dropping down. Okay, what is happening all the way into the hip? Because it's so important to that golf swing as well. So when we have an inverted position like this, so we see subtalar joint inversion, write this down if you need, or stand up and feel it for yourself. When you go into an inverted position with your legs, do you feel that they go like this, that they externally rotate? And then go onto the inside of the foot where you evert. Do you feel that your tibias just went like this? Your knees just knocked inward. So that is a couple, okay? Subtalar joint inversion is coupled with tibial external rotation. Eversion of the subtalar joint is coupled with subtalar joint internal rotation. Internal rotation of your leg and your hips is essentially a loading and an unlocked position. External rotation of your hips is going to be a locked and power position. However, if your golfer has a locked inverted foot and they're trying to move through the subtalar joint during their golf swing and their foot is stuck in inversion and they can never evert it and drop that navicular to get that range of motion, their hip is going to be locked as well. Feet, rigid hips, goes together. And then similarly, if you have an athlete that has a everted foot and a dropped navicular, you can actually measure what's called navicular drop. And you're saying, okay, how come it's hard for you to get into your glutes, to activate your glutes, to get external rotation into your hip, to get power as you swing the golf club, right? It could be that structurally they don't have the range of motion or the mechanical stability in the foot to actually support that position of the foot and the hip. This is where there are certain golfers that I've treated that I actually need to give them custom orthotics because they are so dropped in their navicular and they are trying to activate their feet and they strengthen their feet and they try the Naboso products, but they're just too dropped in that navicular that it is actually mechanically what is making it difficult for them to get into their hip and optimize their golf swing. Okay, so that's what I want you to start thinking about from the mechanical influences of the foot all the way to the hip when it has to do with the golf swing. Do they have the potential? Okay, is it something that we need to bring mobility to the subtalar joint and the ankle, or do we have to bring stability to the subtalar joint and the talo-navicular joint so that we can get that stability higher up? Okay, I'm hoping that that makes sense from the mechanical side. Now, one last thing that I'm going to add to this before I start to transition to then the sensory side of the foot is that one of the biggest drivers of this foot on the right is limited ankle dorsiflexion. And the causes of that limited ankle dorsiflexion in your athlete isn't always necessarily going to be tight calves, tight soleus, okay? You could have an athlete that has a structurally short Achilles tendon. And if they do have a structurally short Achilles tendon, you may want to be looking at the golf shoes that they're using to make sure that they are not entirely flat, that they have a little bit of a drop to allow them to get into that ankle range of motion so that they can unlock the foot and lock the foot based off of the timing of the golf swing. Or if they are someone that has a bony block. So this is one that I saw recently in one of the golfers I was working with, is that he had a talus that was shifted forward just because of prior ankle injuries. So he had a bony block or an anteriorly shifted talus. So every time he went to slightly shift that tibia forward during his golf swing position, he would compensate, go around the ankle joint and drop his navicular. And he was having a very difficult time trying to get that foot stabilized just from an intrinsic muscle perspective so that he could get into his hip and get optimal range of motion from the hip, optimal external rotation into the hip. So that's where I want you to start thinking of, okay, what is the role of mechanical? Now, oftentimes when there is a mechanical instability, or you have an inverted foot or an overly everted foot, this starts to change the baseline weight distribution of that athlete. And if someone starts with an asymmetrical weight distribution, it's going to be difficult for them to have a proper pressure shift during their golf swing, because they didn't start centered. So I like to make sure that if this is one of the athlete's foot type, you got to get them set up. Step one is we need to either mobilize the feet so that a highly inverted rigid foot can find its tripod and find neutral, set its base is what I call it. And when you set your base, you are essentially saying, find a plantigrade foot on your foot tripod with even body weight or pressure distribution in the, I like to think of it as 4 quadrants of the foot, where you have a front, a back, a medial, and a lateral, right? So we want to be centered on that. Now, if I find center, now I can go through the rest of the appropriate weight shift of a golf swing, okay? But you gotta first start centered. An everted foot is going to also have a very hard time finding a neutral base, a balanced 4 quadrant pressure distribution, because they're collapsing inside. You're going to see obviously a lot of medial shift. A lot of these are also very much centered into the heels. You want to make sure that they're not too dominant into the rear of the foot versus the front of the foot. A inverted foot is going to be a little bit more shifted to the front of the foot, right? So we want to first find that base. And that's something that's where the Boditrak pressure mat is really good, because you can say, okay, find neutral, stand in a even pressure distribution or weight distribution under the feet. And then you can see, and you can show the athlete, okay, that's not centered. You are all the way in your heels. And then they could say, I never even knew that. So then you teach them where center is, and you say, that is what a balanced, neutral, evenly distributed pressure distribution feels like. And then the athlete or the client can say, okay, they need to reset what they perceive as centered. And then we, of course, go through it. Okay. So now we set them in their neutral base. Now it is time to then go through the actual golf swing with the appropriate pressure distribution and that weight transfer or the pressure transfer throughout the swing. And this is where you guys, I don't need to teach you what that is. I am here to go through and say, how can we think about the mechanical restrictions that allow us to do that optimally? Or how can we understand barefoot science and the science on the skin and the bottom of the foot to then optimize that as well? So if you have a athlete or client that is very much disconnected, they're not tuned into their feet, they don't feel where their foot pressure is, this is where we need to help them by turning the noise up to the sensation under the feet. For that, you need to know what the skin in the bottom of the feet is sensitive to. And this is where you find your special nerves, which are called mechanoceptors on the bottom of the feet. This is where we have our Mechal disc, Ruffinienses, corpuscles. These different nerves are sensitive to 2-point discrimination, which is referred to as texture, skin stretch, and vibration. So the more that you can stimulate those specific nerves, the heightened awareness you will help that athlete to have. Now, I often will say that as soon as we go into shoes, especially cushion shoes, you start to disconnect the awareness of the foot and the way that you are able to balance your pressure distribution because of essentially the damping effect of footwear. So a shod environment is going to be one that is delayed, it's reactive, it's uneven, it's tuned out, you're sensory disconnected, it's less efficient, you have energy leaks. So all of these are associations that you can see within a shod environment. Okay, we want to help our athletes, especially golfers, because of the subtle nature of the weight shift or the pressure shift in golf, that they have to have an awareness, right? It's a high skill. All of you who are tuned in here and who work with golfers, you know that it's a high skill, right? How can you help them connect to their feet? So that awareness of the pressure distribution is layer one. And then the second one is the awareness of the timing of that pressure shift. So how we are helping athletes and golfers specifically become more aware of their pressure distribution is through the Naboso insoles. And again, one way you could do it is with the Boditrak mat, and you can see and you can tell them, and there's a biofeedback nature that I really like about the Boditrak mat, is that they can see, oh, this is what happens on the screen when I lean forward. Oh, okay, it's becoming more red. I'm over here. And then they get that real-time feedback of where their pressure distribution is under their feet. Once you get off the mat and you're on the greens, how do you carry that? You can't carry that when the athlete is off of that mat. And that's really where we're trying to position the Naboso insoles, is to then follow the golfer so that we are there saying, here, feel the texture underneath the feet so that you can feel you're too medial, you're too lateral, you're too forefoot, or you're too rear foot. So what we did at Naboso is we did a pilot, and we took 50 golfers and we had them use our activation insole, which is the blue one. It's here as well. You can see this is a 2-point discrimination pattern, which technically is the SA1 Merkel disc. And we had them use this in their golf shoes. Now, what I think is important to understand is that 85% of these golfers had never heard of our insoles. So they didn't drink the Kool-Aid already. They were brand new. They didn't understand what this textured insole could do for them. We had them put this in their golf shoes, play an 18-hole, and then fill out some questions based off of how they responded. Were they more aware of their feet? Did it have any effect during their golf game? Did they have less fatigue? Just share with us a little bit about what you noticed using textured insoles in your golf shoes. So we had, of those 50 golfers, 94% noticed increased foot awareness and pressure distribution during a round. Right? That's what we wanted to see. Okay. That is so important to golf, that can this little 2mm insole actually help those golfers with the most important aspect of the swing, is the subtlety of that pressure distribution, 100%. And then testimonial was, the insole texture provided constant stimulation, which made me more aware of my feet and the terrain. They also decreased foot pain and pressure spots. So that's great. Now, 87% said that they noticed a benefit from the insoles, which correlated to their golf game, right? Did it enhance their golf swing because they now had a more acute awareness to the pressure distribution? Okay, here's one of the feedbacks. Definitely shot one of my best rounds this year. I felt like it was more consistent. I was more consistent with my shots. I think it was the increased awareness of my feet. And that is our goal. And then finally, 98% said that they would wear the Naboso insoles again and buy them for their golf shoes. And these are just a few of the testimonials of those 50 golfers. Now, outside of the Naboso insoles, what else could you do for your athletes, right? How else can we increase foot awareness before our golfer puts their shoes on. Here's a few ways. First one is to do a plantar foot release. One, I believe in releasing the bottom of the feet every single day, at least 5 minutes, but there's actually research that shows just 5 minutes of a trigger point release to the bottom of the foot can increase foot awareness and balance. Now, we might not be trying to enhance balance, static balance in a golfer, but a big part of balance is awareness, foot awareness, postural awareness, right? Mass awareness. So the same thing here. Can we release the feet as a foundational practice for our golfers before they put their golf shoes on so that they can stay connected to their foundation? I would say 100%. Pictured here is the Naboso neural ball, which has the textured stimulus. So while you're doing the trigger point release, you are getting that sensory stimulation. Second one is to incorporate barefoot training. So the more that you are integrating barefoot cross training, so when the athlete or the client is not actually golfing and they're on the greens and they're doing kettlebells and squats and any other training program that you have them doing, can you do it barefoot so that they stay connected to their foundation? It becomes really a philosophy of training that you want them to understand that everything starts from the ground up, from their golf swing to their squat to that kettlebell swing. So training them barefoot, hugely important. And for this, you do want to make sure that you are looking at surfaces. So kind of blend into the third one is that using different surfaces. So be on a hardwood floor, do it on the grass, go outside and be on the grass and allow them to feel the subtlety of that surface. Do it on the Naboso training mat so they get that textured stimulation. If you have a whole body vibration platform in your facility, using that as well is really, really good. One thing that I will say is if you happen to have the Boditrak system, the top cover is the Naboso material. So I always say to everyone who uses Boditrak is that not only is this your assessment tool to get a feedback and kind of real-time data of what is the pressure distribution of that athlete or that golfer, but now turn the computer off if you want and just train the athlete or the client on the top cover because it's Naboso, you're stimulating their feet. So it's really a training tool also as an assessment tool. Playing golf barefoot, I'm always supportive of this because you just get to feel the full range of motion. And I do want to add that if the client or the golfer has some sort of restriction in range of motion or they have a neutral foot, all footwear or a majority of footwear to some degree actually restricts some of your natural motion. And the way that you can find that is take your athlete's shoes, and if you can twist it, so creating torsion in the shoe like this means more freedom of movement. If your golf shoe has a counter, so a stiff counter on the back, that's going to limit some of your subtalar joint range of motion. If you can't twist that shoe, it is going to block a little bit of what that midfoot is doing. Now, if the athlete has too much range of motion, instability with midfoot collapse and too much eversion, technically those are a positive. The shoe could actually help control some of that excess range of motion. But not everybody needs that control of range of motion and that counter and the stiffness in the shoe. So we want to be looking at everything in an individualized way. And then number 4, finally, is to get them into minimal shoes. Can you get a more freedom of movement? I understand if some of the golf shoes don't have that freedom of range of motion and the toe splay and the wide toe box, completely understand that. Can we use the insoles in that golf shoe to keep them connected to their feet? Excellent. Then when they're doing any of their cross training, when they're not on playing golf, then have them in minimal shoes to just kind of always stay connected to our feet and our foundation. So as we kind of go through this, I just want to briefly recap so that it'll kind of summarize everything for you. And then I would gladly take any questions that you have. As you're thinking of those questions, I am going to have Libby from Boditrak just kind of jump in with some comments from her as well. So at Naboso, we have our insoles, we have mats, we have flooring, we have the neural ball that you saw a picture, we have toe spacers that we're launching this week as well. So do check out our products, do try our insoles, use code SAVE15 to get 15% off. We are working with a lot of golfers. We're working with a lot of golf courses and pro shops where they're selling our insoles, and definitely do kind of see where you can use some of these practices to build increased foot awareness. So we got to be looking at our athletes. What is their potential mechanical range of motion? Is their foot type throwing off their just a baseline pressure distribution, where their starting point is? And then if it is, it's going to be really hard for them to find an optimal pressure transfer if they're not starting in that neutral position. And then on the flip side is, what is their awareness? If they're so disconnected from their feet, how are you going to teach them this subtle skill? And that's where Boditrak would come in, and that's where Naboso would come in. So Libby, I'm going to pass it to you so that you can make some comments about Boditrak metrics and golf.
So can you hear me okay, Emily? Okay. Thank you so much, first of all, to Emily. That was absolutely fantastic information. I loved it. I am an exercise physiologist and movement specialist, so she was talking my language and making a lot of sense. And, you know, I think Emily did a really great job of almost explaining what I was going to say is, when you're working with golfers, athletes, particularly golfers, there are two components to it. One is you've got your golf teaching professional who is working on the swing analysis and connecting the dots using the ground reaction forces with our mats. And then we've got movement specialists who are trying to analyze the body mechanics. So what we want to do with Boditrak is connect those dots so that we've got our golf professionals who are working on the swing mechanics working collaboratively in a partnership with our movement specialists and our people, all of our clients that are working with the body mechanics. Like Emily was explaining, if there's certain joints and movements that are not properly set up, then that needs to be addressed to help make the performance with the golf swing optimized. So it's really a collaboration between two professionals, those that work with movement training, whether it's a physical therapist, physiotherapist, a movement trainer, sports performance coach, and then your golf swing professional. So that's where Boditrak Golf comes in. Boditrak Golf is our golf brand in Boditrak, and they do work with golfers specifically, have a lot of great educational information about ground forces, pressure traces, and also weight and pressure distribution. Then I head up the Boditrak biomechanics, and we work with the healthcare professionals like your physiologist, physical therapist, chiropractors, wellness professionals, your movement specialists, and then also sports coaches. So those two work very well together, trying to do what Emily is an absolute brilliant expert at, is helping people move better. So that's why we love working with Dr. Emily. She's absolutely brilliant. She's wonderful wealth of knowledge, and her specialty is helping people move better. Thanks, Emily.
Of course. Thank you so much. So if you are new to Boditrak, please do check them out. If you're new to Naboso, please check us out. I will take any questions that you have. And then if you have some that are targeted to Libby and Boditrak, please type those in as well. All right, so Mike has a question. I think a good assessment of the rear foot mobility and its relationship to midfoot mobility is essential to all considerations of balance. Agree. Which one is hyper or hypo? Which one is compensating for the other? This is critical to the golfer and most clients complaining of a loss of balance. Sorry, that was a thought, not a question. But yes, Mike, I agree 100%. Sorry, I agree with you 100%. And Mike is a podorthist, so completely understand your training. Thank you for listening, Mike. And thank you for adding in that comment. Great. Any other questions? Now, as you're thinking of questions, if you do happen to want to dive a little bit deeper into some of the joints that I was explaining, if you're new to foot and ankle, and sometimes it can be difficult to conceptualize the movements of the joint, especially the midfoot can get a little bit complicated, then please do check out ebfaglobal.com. That is my education company. So I have Naboso is my products company, EBFA Global is my education company. And we have online courses. We do live courses about how to assess the foot, mechanics of the foot, and really how we would create the protocol. So Mike is saying, do we have training protocols? Absolutely. So our certification is called Barefoot Training Specialist, and that is online. I'm just going to type in the URL so that everybody has it. This is a 2-level course where we go into the anatomy, mechanics, assessment, and then programming based off of foot typing is what I call it. And then everything that we speak about, my philosophy as a podiatrist is that your feet are integrated with the rest of your body as they are, but specifically your core. So we call it foot to core sequencing. This is done through fascia lines. This is through integrated mechanics. And this is also through sensory stimulation. So those are the three ways that I look at the foot: is biomechanics, sensory, and fascial connections. And those are a really comprehensive way to help you understand the way that our feet and our foundation integrates for balance, for golf, for runners, for, myriad of applications. So please do check that out, and then try to integrate that with what you're doing, whether it's Naboso, Boditrak, or many other modalities as well. Great. So if there are no other questions, I want to thank you all for your time. Sorry, there is a question. Okay.
Almost didn't make it.
So how does flaring the feet out 20 degrees address or impact the stability and activation of the foot at impact? Flaring of the foot is done to allow smoother turnout of the hips. Yes, so that is where, so when we turn out the foot, this is where you can oftentimes see what it does based off of the swing, or just kind of take a step back and look at the way that changes how they roll through their ankle. Oftentimes when we turn the foot out, it can be a deviation out of the ankle joint. So this is where I would have to watch the golfer with the turnout and see, are they going around the ankle joint or through the ankle joint? So that would be my response to that, is see, yes, does it optimize the hip, but is it at the risk of something with the ankle movement? And then the way that I like to think about the foot as just kind of a final takeaway is always look local. So bird's eye view, film the foot if you need to, film that, and then pull back and look at the whole body as a system. Sometimes if we look too system wide first, we miss these subtle natures of the feet, which is why when I teach everything through EBFA, I start with a really zoomed in foot perspective. And then in our level 2 and more advanced courses, then we go out to see what's happening. But we need to understand the normal locally, and then we look at compensations locally, and then we look at it systemically. So I hope that helps, Greg. Really good question though. Perfect, great. Okay, so on that, I will then wrap it up. Thank you to everyone who has tuned in live. If you're listening to the recording, thank you so much. Thank you, Libby, of course, and everyone at Boditrak. Perfect, good. So you will get an email with the recording and the handout. Make sure you're following both Naboso and Boditrak, and have an amazing day or evening, depending where you are. Thank you all.